Hi, everyone. My name is Dr. Sandra Primiano. I'm a psychologist, and I'm the Vice President for our Employee and Family Assistance Program and Counseling Services at Homewood Health. Welcome to tonight's presentation. We're going to talk about COVID-19 and reducing anxiety and managing transition back to the class or back to school. For all of you, for post-secondary educators. So I'd like really to provide you some practical information about some of the issues that you might be experiencing regarding stress and anxiety due to a lot of changes and adjusting to going back to the physical workspace, potentially having to adjust to offering courses online as well. So hopefully some of this will be helpful for you. I would encourage you, if you have a pen and a paper, it might be good to take some notes. There'll be a couple of just practical exercises that you might want to jot down to participate in. And I would say make sure you have a comfortable spot and maybe you grab a glass of water or something as we go through some of this content. And I'd like to keep about 10 or 15 minutes at the end of the presentation to discuss any questions or concerns or things that come to mind. So we'll be able to do that at the end. You can submit questions that we could look at. What I'd like to look at is really helping you to increase awareness concerning anxiety, and as it particularly relates to the change process with respect to the current context. There's been a lot of change, and change is something that can be stressful for everybody and destabilizing, and over a sustained period of time can lead to anxiety. And I want to look at strategies to manage anxiety, to increase well-being during times of change, which is particularly important when you're in a helping profession, field, when working with others, when educating people. We have to feel well ourselves to be able to do effective work with them. So just in terms of the agenda, we're going to look at anxiety and change as it relates to COVID. As I briefly mentioned before, that with change comes stress, and with prolonged stress can come different states of anxiety. So practical strategies to help manage anxiety through more difficult times, and really looking at how you can support yourselves as educators through transition process, through these changes, and preserve well-being as you return to work. So I briefly just mention this, that COVID really, the way I see it and the way we can conceptualize it is that it's been a period of remarkable change really on many levels, and having so many different areas of our lives affected at the same time can cause a lot of uncertainty for people. It can cause a lot of worry and stress, and it's really quite normal because there's just a lot happening at the same time. And when I think of teachers and I think of educators, there's definitely been a lot of change regarding modifying the way that you're offering lessons. You were asked very quickly to adjust when schools closed and offer classes online in a virtual environment, which may have been new to a lot of people, and there wasn't a lot of time to adjust. And since then, 6-7 months have gone by, and there's been a return now to in-person teaching, and even that is uncertain because we don't know if schools will stay open or they'll close. And so the environment is quite different, and we can have a lot of different concerns about our own health and safety and well-being, our family, our friends. We've had changes in our personal lives in terms of limitations for recreational activities and hobbies. It's affected our relationships, the way we socialize. We can have childcare issues. Some of us have been working from home, taking care of children. Other people have had financial struggles. And so basically, it's a lot to deal with. It's a lot to adapt to at once. So a normal response to that is to feel a great deal of uncertainty and stress. And then feeling stressed over a prolonged period of time can lead to anxiety. We start to worry. We start to imagine different scenarios. We start to maybe think of the worst case scenario, and we become tense. And then we're in this state of tension for so long we don't even notice that we're feeling like that anymore. So if you do have a pen or paper, you just want to think about it, I invite you to really think about maybe one or two of the biggest changes that you've experienced over the past 6 months, and how do you think you've coped with it? So just whatever comes to mind, whatever kind of change has really impacted you. Just take a second to try to think of what that might be. So in this section, I want to talk a bit about change and transition. And really, we can see it as having a few distinct phases. It doesn't mean that everybody will follow these phases and it will be it will go in that way for everybody. But what I want to highlight is the first phase is when there's an ending. And often it's when a change is not chosen, like we can see with COVID. Well, none of us necessarily, we didn't anticipate COVID to happen. We didn't anticipate or necessarily welcome a lot of the changes. And so it's met with different feelings that can include anger, fear, there can be shock. But also what I really want to highlight here is loss and grief. And we've all experienced loss because of the pandemic in different ways, whether it be loss of a job or social activities or relationships or routine or a certain amount of self-care. There's been loss, and with loss there can be grief and a period of confusion and shock in this change. So likely this is something that most of us probably experience to a certain extent at the beginning, maybe even now as change is ongoing. And in the second phase, in the transition phase, this is usually when people consult a psychologist or a counselor or want to talk through certain issues that they might be having. And this can be a chaotic kind of time with a lot of confusion and uncertainty. Something has been lost or is changed, and it's replaced often with something that maybe is unfamiliar, that we're uncertain of, that maybe we didn't quite want. And so there can be a lot of confusion and sadness. But what's good in this phase is it's also a time to explore and to understand and to make sense of things. And a lot of growth can come out of that as we move into that last kind of phase of beginnings and new beginnings. That can be a nice time for growth and developing resilience. And so even out of these situations, we can learn a lot about ourselves through challenges, and we can push ourselves to develop in different ways. And so when we do get to that point, there's a certain amount of acceptance for what's happening, and a certain amount also of even excitement for what's to come and what might be new. So if you think about where you're at and how it's been in the last 6 months, I would invite you to think about if you identify with any of these phases or all of them, and where you think you're at in terms of the different phases. And just based on that, is there anything that would be helpful for you at this time, or is there anything that that might be useful depending on where you're at and where you might like to move to? I would think about that and how it might apply to your current situation. And so here, I want to talk a bit more about loss, and loss being an important part of change. And we really need to acknowledge what we've lost and what we might be feeling. And so when there's a lot of change and this kind of a sense of loss, sometimes we can have different issues and challenges in making decisions based on emotions. Like, we can be impulsive and maybe not think things through. We might avoid people who could typically provide us with support. We might stop doing certain activities or things that we like to do. We might not consult information that we need because it's overwhelming, or it just we're too tired or stressed to do it, and we could sort of jump to conclusions in here. And so what's really important is to acknowledge what we're feeling. And I'll probably say that more times than you want to hear, but really being able to be aware of our emotions, be aware of what we might be experiencing, of that sense of loss in particular, to be connected with that, and to be mindful of not needing to act right away, or being, impulsive or finding a solution right away. We might need time to just sit and think about it. We might need time to connect with people for support, to talk things through. And we want to also take care of ourselves and make sure that we're still engaged in activities to help promote a sense of well-being. And those activities may be very different now. Maybe before you were able to go to, to the gym, or maybe you had group classes, and so some of that's changed. And so we need to be creative and think through different activities and things that we can do now, given the current limitations and our current context. So I want to talk about anxiety and how important anxiety is. And this is really my background and what I studied in my Ph.D. in my area of expertise. And anxiety it's really a universal experience, and it's so normal. And basically, it's the way our bodies respond to perceived danger or threat. It's really a useful reaction. And if you think back to the environment that our ancestors developed in thousands of years ago, if they were being chased by an animal, or they had to protect themselves, they needed to physically mobilize themselves and run or fight, or do something to avoid negative consequences. And so that's sort of how we think anxiety developed, because if we didn't have that stress to mobilize ourselves to spring into action, we probably wouldn't survive. And so the difference in today's society is that a lot of those threats are mental, are psychological, and we can see, COVID on different levels, but your body doesn't know the difference between being chased by a bear necessarily and COVID. They're both threats. And so we react to that, and it's sort of our alarm system to say, like, hey, something is dangerous. And so really, it's not a disease. It can become a mental health issue when it's chronic, when it causes a lot of distress or impairment, but in itself can be very adaptive. So I would really encourage people to be aware of stress and anxiety, to be able to normalize it, to explain to yourself that, okay, it's okay. What am I perceiving as a threat here? What is leading me to react like that? And allow it to exist, allow it to be there. It's there for a reason. And often in that way, even intense emotional reactions will dissipate when we just give them enough room and space. And then the important thing is to figure out, what do I need to manage this? And not everybody needs the same things or benefits from the same things to manage their stress and anxiety. So it's important to have insight and then look at, okay, what do I need? But before going into that, I would just highlight here that there are many different manifestations and symptoms of stress and anxiety, and typically people aren't really that in touch with it. When people consult a clinician, they don't often right out say, I have anxiety, that's why I'm here. Sometimes they do, sometimes people know that. But often it can be sort of a physical sensation that, well, I feel unwell, I'm getting headaches, my stomach hurts, like I'm not sleeping as well, or there might be things that you start to avoid or people that you start to avoid. And so it can manifest itself in different ways. And we can have physical symptoms. If we have tightness in our chest or dizziness, upset stomach, accelerated heart rate. We can have psychological symptoms or cognitive symptoms like worry, creating what if scenarios. What happens if this happens? And then if that happens, and then I'll do this. And then, what if, and we get kind of stuck in these cycles, or we have catastrophic thoughts that, it's the end of the world and I'll never be able to get over this or recover or deal with this. And I'll talk a bit about this later, but that really affects our psychology. When we start to get trapped in those kind of anxious or depressive spirals, it really affects how we're feeling. And the more we stay in those kind of cycles, the easier it is to be in that state and then to recall and make those kinds of connections. In the sense that if we're often thinking about very negative things and worrying, it'll be easier for our brains to conjure that up and be in that kind of state, which can lead us to develop more anxiety and more depression, versus when we're able to have more balanced thinking, more realistic thinking, or even focus on positive experiences and feelings. That's actually very beneficial for us psychologically. And then, of course, there's some symptoms of behavioral symptoms, avoidance, and certain emotions that we might feel that accompany anxiety. So returning to the classroom, as you all have by now, there are a number of different concerns. Probably some that you have that aren't listed there, but thinking about contracting the virus, spreading it to family, carrying it, maybe also being unable to meet your own standards. Things have changed. The teaching environment is different. You may not be able to uphold exactly the same standards or guidelines that you would typically have, and that can be quite stressful too, as well, especially with moving back into the classroom and certain limitations, and then potentially moving back to a virtual environment as well. So if you do have a pen and a paper, you just want to think about it, I would ask you to think a bit about a couple of things, a couple of worries that you have that pop into mind. What seems to occupy some of that mental energy and space in your mind about returning to the classroom? Because likely this is a worry that comes up often. So it might be something to be familiar with, and then consider how you can address it. So I'll just give you a second to think about that. Okay, so in this next section, I really want to get into more of the strategies. And so they're listed there, and we'll go into all of them, but focusing on things we can control, healthy thinking, and then some different items in there about how to create a more positive dialogue, and focusing on the present moment, practicing acceptance and self-compassion, mindfulness and gratitude, and then maintaining social connections and limiting consumption of media and taking care of ourselves. So we'll go into them individually. So it's really important here is that uncertainty is uncomfortable for everybody, and with change comes a lot of uncertainty. And so COVID, like I said at the beginning of the talk, is representative for all of us. It has been representative of change, and so it has created a lot of uncertainty, and that's uncomfortable. So naturally, we want things to be certain and in our control, but there's so little that's actually in our control. There are some things, and we need to definitely focus on those things. For example, practicing best guidelines to take care of ourselves, to protect ourselves and those around us. practicing, focusing on our inner dialogue and what we're thinking, how we're treating ourselves and others. And then there's just a ton of other things that we can't control, like how others are behaving. Are they respecting the guidelines? Are they practicing physical distancing? What the schools are going to decide, what the school board will decide. There's so many things we have zero control over. And so what I want to highlight is, for the things that we don't have much control over it's really important to find ways to accept our emotions, like to be aware of what we're thinking and feeling. And even though it's uncomfortable, to sit with that, the fact that we don't have control over that, and we may be thinking or feeling certain things, and to remember that our thoughts are thoughts, emotions are emotions, and they're not more than that. In a sense, they can't harm you, they're not fact, they're not necessarily reality. And so we react to them, but we can choose to say, well, this is just a thought. It's an unpleasant thought. I don't like the thought, but it's just a thought. And in that way, I can distance myself from it, let it be there. And I can do the same thing with emotions, and they will come and they will go as they came, just as easily. And think about, I think the most important thing to remember is there's a paradoxical effect when we try not to think of something, or we try not to feel something. So if I say to you, try not to think of a pink elephant for a minute, well, I'm sure it took like 1 second and you're all thinking of a pink elephant. It's impossible. So if we try to repress something and we don't allow it to be, it will just be there longer and be more unpleasant. And so I alluded a bit to this, but we need to give some thought to what we can actually control and what we can't. And I think the first thing that comes to mind for me are following different rules and guidelines, and mask wearing, and so in the work environment and the school environment, we can't control what colleagues are going to do, how they're going to wear their masks, how close they're going to be to us physically, what kind of space they're going to respect. And so we have to focus on what we can control and what we can do, how we're wearing masks and washing our hands and protecting ourselves, and respecting physical distancing. And also, I think what's important is to focus on how we choose to teach students, how we choose to show up for them. We're role models to a certain extent, and we have that opportunity to show them a different way of coping, maybe than they're used to. Maybe they have highly anxious parents, and we have that opportunity to show them something different. I used to work in high schools and elementary schools as a school psychologist, and with teenagers, and it's such an opportune time to really demonstrate a different example, and through our own behavior, help model behaviors for them that they can learn from, and even being able to share things that you do or that you find helpful. And those are all things we can control in this kind of setting. So I'm going to talk about practicing healthy thinking. So the first point is around creating some distance from thoughts. And so there's a couple of things there. The stop, observe, and describe is a dialectical behavioral therapy type of technique, and it's developing awareness about our thoughts. Just taking a minute and realizing, what am I thinking? What is that related to? What am I telling myself? And how does that make me feel? How does that make me behave? And we can do some work on that. We can change our internal dialogue. We can really look at what it is that we're thinking and how it's influencing us, and then focus on what we can do and what we have control over. So if typically we see somebody not respecting a guideline, and we feel angry, and we criticize them, and why are they doing that, and this person is so ridiculous, we can realize that we're doing that and change what we're saying to ourselves and think like, okay, well, what can I do in this situation to feel better? What can I do right now in this moment to change what it is that I'm thinking to help myself? Really, it's that I want to feel better. I want to help myself. And so a useful exercise, and you can think about it now if you'd like, is to pay attention to your internal dialogue. Are there thoughts like that that you have in the day that regularly come up for you, that cause you frustration or anger or sadness? Are there things that really irritate you? And in those moments, what is it that you're saying to yourself? And what else might you like to say to yourself that could be more helpful in that moment? So think about that. If there are things that come to mind now or tomorrow, that's a good place to start. The second point here is really focusing on the present moment. The present moment is really the only reality that we have that exists. When we project ourselves too far in the future, it can lead to stress and anxiety. It doesn't yet exist. We're creating a world that isn't real yet. When we're focusing on the past, it can be depressing. It can be sad. It can, it depends on what we're thinking about. If we're thinking about positive experiences or good experiences, that can actually be quite nice for our psychology. But we really want to focus on what is happening in the here and now. And it can be really simple things. It can be if you're enjoying something you're eating, focusing on what you're eating. It can be focusing on the environment, looking at things that are around you in the environment that you see visually. It can be engaging in an activity, if it's teaching a certain topic or talking to somebody, or even cleaning up or washing dishes. The idea is that your mind doesn't wander. It's that it stays focused on literally whatever it is that you're doing in that moment. And that if it does wander, you bring it back to the present moment. You bring it back to what it is that you're doing. And then this last idea, might sound strange if you've never heard this concept before around acceptance or radical acceptance. And if you're interested, there's a lot written on it, and it is part of dialectical behavioral therapy, but there's a lot of resources accessible. But really, it's choosing to accept our current state as it is. And it's acknowledging that when we resist what's happening, when we resist reality, we cause more suffering for ourselves. So we have a difficult situation, and when that's met with lack of acceptance and resistance, we cause more suffering. So we have difficult situation and suffering, and then with lack of acceptance, we're causing more suffering for ourselves. So it's not condoning, it's not agreeing, but it's not struggling. It's saying, I might not like what's happening right now, but this is the reality. I need to wear a mask. I need to, teach in this way, show up in this way. This might not be great or what I want, but this is what I'm faced with. And what can I say to myself? What can I focus on that's better than fighting the reality and saying, I don't want to do this. I wish this wasn't happening. Anytime we're in those kinds of thoughts, we're in a state of non-acceptance. And non-acceptance is going to cause struggling and more suffering. So when you catch yourself in those kinds of thoughts, like, this isn't fair, why is this happening? I wish this wasn't happening. You're in a state of non-acceptance. So if you take a step back and think of, okay, what can I do to help myself? This is my situation. This is the reality. And how can I be better in it? It will reduce a lot of suffering. And just as I mentioned before, there's a lot written on this. So if it seems interesting or really weird to you and it didn't make sense, I'd encourage you to look at it a little bit more. And once you read and understand a bit more about it, I think you'll find it to be really helpful. Self-compassion. I love the concept of self-compassion because we know that it's linked to so much positivity for ourselves, for well-being, happiness, optimism, decreased anxiety and sadness and rumination. And it's really quite simple. It's just hard to do, especially in Western society. We're very critical. And what's different too about self-compassion compared to something like self-esteem. Self-esteem fluctuates, and it depends on what situation you're in, where you're at in your life, what's happening with you. But self-compassion is something that you can apply all the time and in any kind of situation and state. And it's so beneficial to us psychologically. Also physically, our bodies release more oxytocin, which is the bonding hormone. You probably heard about it with respect to pregnant women. You release a lot of oxytocin to bond with your child and create attachment. And in the same way, we release oxytocin when we practice self-compassion towards ourselves. So really being kind to ourselves, paying attention to what we're saying to ourselves, not judging ourselves harshly, accepting what's happening, but accepting our faults. Like if we mess up or we do something that we don't think is great, well, but that's okay. Nobody's perfect. Everybody makes mistakes. And so we have a choice in how we react to ourselves. We can either judge ourselves and criticize ourselves terribly, or we can choose to be self-compassionate and actually physically, the kinds of hormones we release, and psychologically that will allow us to feel better. If you like to learn more about that, there's a good book by Kristen Neff, N-E-F-F, and she writes a lot about self-compassion, and there are different kinds of books and workbooks and things. Anyway, it's really interesting if it's an area that you want to learn more about. And they're basically 3 components. I talked a bit about that: kindness versus judgment. So to practice being kind to ourselves as we would to a friend, as we would to somebody that we loved, versus judging, recognizing again that it's a common experience to everybody. Nobody's perfect. Everybody fails. Everybody makes mistakes, and it's really okay. It's not just you. Everybody struggles with this. And then the mindfulness versus over-identification is really, again, being able to sit with that discomfort, being able to sit with that kind of suffering or discomfort that we don't like, and allowing it to exist, and then knowing that it will likely leave as quickly as it came, and not to fight against it. So mindfulness and gratitude, 2 other really simple, great strategies that can help us with our stress, with our anxiety, with depression as well. And so mindfulness, you've probably heard a whole lot about it, maybe even practiced it, but the takeaway for mindfulness is that we're paying attention to reality in a particular way. We're paying attention to the present moment in a particular way that is usually without judgment. So we're observing, describing, participating effectively in a non-judgmental way on whatever we're doing. And that there are so many different ways to do it. It can be through mindful breathing. It can be just being mindful about an activity that you're engaged with in the present moment. It can be about things that you see, things that you feel in your environment. You can use your senses. So there's a lot of different ways, and there are quick ways to do it, even just in a couple of minutes. When you're feeling stressed, take a break, take a pause, and do some mindful breathing for just a few minutes, and you feel better, because it's a way to calm the nervous system. It's a way to calm the sympathetic nervous system, and we just feel a release of stress. And so if you're interested in learning more about it, there are a lot of resources. There are a lot of recordings online for mindfulness breathing, or just ways of paying attention to the environment with your senses. There's one I really like, when you use your 5 senses, like you name 5 things that you see in the environment, that you feel. It can be things that you perceive, and it's really just a quick way to relax that you can easily do throughout the day. And gratitude is really looking at what we're grateful for in life, and focusing on some of those more positive moments and experiences. And we know that practicing gratitude is also very beneficial for well-being, for happiness, and is a habit of people who tend to be happier, more resilient. And it also helps psychologically to be more positive by focusing on those things that are positive in our lives and that we're grateful for. So some mindfulness and gratitude practices. There's mindful breathing, concentration, releasing tension, looking at what went well, sending appreciative notes, for instance. And so the mindful breathing is really focusing on breathing in and out, inhaling, exhaling. When we want to focus on the way that we're breathing in terms of our breaths coming in and breaths coming out, and focusing our meditation on that, we can concentrate on the kind of breathing that we have, and we can count in and out for a certain amount of seconds. For instance, we can breathe in for 2 and then breathe out for 4, and just as we're breathing, that's what we're focused on when we're breathing in. All the time we're breathing in, all the time we're breathing out. And it's just a way to focus our attention, to focus on what we're doing, and will help us de-stress. And when we talk about releasing tension, really it's important, as I was saying, just to be in touch with what it is that we're experiencing, and we can do a sort of a body scan and see where our tension is sitting. Often it's in our necks or our shoulders. We don't even realize our shoulders are up, and okay, so we want to see where that tension is and release it. And we can breathe mindfully at the same time, and really it helps us experience just a nervous system release and bring down that stress and calm our system. And for gratitude, looking at what went well today, what am I happy about, what am I grateful for, even really little things. It can be anything. Will go a long way in times of stress and in challenging kinds of environments. And also being appreciative and grateful to others is beneficial for our well-being. So it could be sending an appreciative note, or saying thank you, or recognizing somebody's efforts. That also has a positive effect on us. And so this might seem obvious, maintaining social connections, but really it hasn't been necessarily for a lot of us, just due to physical distancing and the changes. But we really do need to maintain our social support. It does help with stress and uncertainty and sadness. And so looking at how we can be creative, how we can connect with people, what that might look like. Is it virtually? Is it through maintaining physical distancing? How do we stay connected? What strategies are we going to use? And how can we support each other and show kindness within our families, our friends, communities? Are there ways that we can contribute? Contributing is also very positive psychologically, and leads to happiness also. When we're able to help others, even in very small ways, it increases our well-being as well. So something to think about. And it will change now, definitely, with the second wave, and with winter coming. It's not as easy to be outside and maintain physical distancing when it's -20. So we need to get creative and think about what works and what helps us, and what we can do. Just want to spend a second here regarding consumption of media. Of course, it's important to stay informed. We want to know what the best practices are, what the guidelines are. There are lots of updates constantly, but we don't need to be connected 24/7. It actually can cause more anxiety. So we need to consider how long we would consult content, what time of day. We probably don't want to do that too late at night, especially if we're listening to news or something like that, because then it can interfere possibly with our dreaming or our sleeping. So we definitely want to be informed, but we don't want to overdo it. So take a second to think about how you consume media, and if it's excessive and interferes with your well-being. So here I want to highlight, it is so important to have good self-care strategies. Our routines often are affected by anxiety, by change, and so likely most of your routines have probably been affected throughout this time. So really looking at ways that we can help ourselves develop a routine, integrate some physical activity in there, healthy eating, sleeping, and really just being aware of the difference. Are we really in a state where we're caring for ourselves or just coping? Are we just kind of getting by? Are we struggling? We want to get to a state where we're actually actively caring for ourselves and not just trying to get by or get through the day. We need to focus on self-care. Like I was saying, in any kind of helping profession, when dealing with people, if we are not well, we cannot help others to succeed. We cannot provide what is needed. And so going back to the classroom, physically, possibly eventually virtually, we really need to acknowledge that there are a wide range of responses that we might have. Some people might find it easier than they thought they would. Others might find it harder than they thought they would. And the takeaway, again, for me here is really being compassionate towards ourselves and not judging ourselves and not being too severe on ourselves if we're not hitting the standards we want or things aren't going the way we want. It takes time to adjust. Allow yourselves the time to adjust and be kind. Try to focus on the present moment. Try to look at what it is that you can control, how you can teach in this environment, how you can influence students, how you can be the kind of role model that you want to be. And so throughout the day, it's really important to check in with yourselves, because you're likely in stressful environments that are emotionally charged and with people having different reactions. And take the time to see, where's my tension in my body? How am I feeling? How am I thinking? What am I saying to myself? To look at what it is that I need and to seek support when you do need it. And that's a sign of strength, being able to know that you may need support, know that you may need to talk through certain things with somebody who's neutral. There's absolutely nothing wrong with that. Everything is right with that. So having insight and knowing yourself is really important. And then, of course, for supporting students, it is really important to maintain a calm learning environment so that they feel safe and that they feel like they can learn and contribute to it as well. Being able to provide them with factual information. And that helps them feel a sense of control when they know what's happening and what they can do to contribute to their well-being and the well-being of others. And really being that supportive, calm presence. Like I had mentioned, some students won't have that necessarily in their lives, and you can exhibit that for them and share ways that you might be coping and different ideas and strategies that might be helpful. And of course, we want to always speak up against any stigma related to COVID-19. Students that might have had COVID-19 and then may be at home and then maybe returning back. We really want to be able to shut that down and make sure that people aren't stigmatized because of that. And so what's important too, employee and family assistance programs are there for you. And we will address a variety of different issues, whether it's stress, anxiety, sadness, depression, whether it's related to life changes and relationship concerns, parenting challenges and childcare, grief, substance use issues, basically any life struggles that you might be dealing with. If you feel that connecting with somebody, a trained counselor, would be beneficial, or you're not sure and you just want to try it, I would really encourage you to do so, because having that neutral space, having somebody who has a trained ear is different than a friend, is different than someone who's involved in your life and could really go a long way to helping you. And so what's important to remember for employee and family assistance programs, like ours. They're accessible 24 hours a day, 7 days a week. There are great ways now to connect with a counselor. You can connect, you can have a telephonic appointment, you can have a video appointment. If you prefer, you can register yourself online, you can call, you can consider different language requests or cultural requirements that you might have. It can be for you. It might be if you're in a management position for employees, for dependents that you have. And of course, it's private and confidential and voluntary and at no cost to you. So something to definitely consider. And if you don't have the number, the numbers are here, and the website as well. Also, another great resource for Canadians is Wellness Together Canada, that's offered by the federal government. And this also allows you to have access 24/7 to support. Connecting with a counselor, you can go to the website. There's great resources on the website. Actually, if you're interested in mindfulness or relaxation or different kinds of mental health strategies, there are a ton, and they're so fantastic and they're free. Or if you want to access one of our counselors as well, you can call in directly for punctual support. So really nice resource available to all Canadians as well. So just as a quick summary here, we talked about the landscape, how COVID has affected our sense of well-being, led to anxiety. We talked about some practical tools and strategies that might be helpful and resources. So I want to take a few minutes and see, do you have questions? Are there things that you might like to talk about? I have one. Are the slides going to be made available? Yeah, so we'll be able to send out a PDF of the slides, and we'll also have the session recorded as well. So you'll be able to have access to that. Yeah, okay. Any other questions or things that you might want to talk about, or that weren't clear, or that you want more information about? If you want me to back up to a slide or something. No questions, but thank you very much. Okay. No problem. I have a question here. I wonder if you have any suggestions for managing during times when the volume of work is high. Yeah, there's a lot of change in our in our workloads, and I would say that focusing on priorities is really important for us, and we might not be able to get to absolutely everything, but wondering if what priorities you can focus on, and breaking things down into smaller tasks, taking one thing at a time, and then if really it's too much, is it possible to connect them with management and sort of look at what some strategies might be, what some solutions might be. I have another question here. Is anxiety the same as a fight or flight reflex? Yeah, so those are reactions that we can have when we're in a state of anxiety, when we feel threat, like when we feel threat or danger. So yeah, so we can fight, flight, freeze are all reactions to when we feel a certain heightened state of anxiety. There are differences. I won't get into all the details, but usually fear is when there's something in front of us, something concrete that's scaring us, like a bear popping up. We're gonna feel an emotion, and then we will engage in fight, flight, or freeze. And then anxiety is really a prolonged state of stress, when there's a change or something is taxing on our resources, and it's ongoing over a long time, and we start to have, beyond that initial reaction, reactions over time, symptoms over time. So not exactly the same thing, but related. What do you recommend we offer students? Sorry, I'm going on to another question. What do you recommend we offer to students? Is there a class like this students could watch? Oh, that's a really good question. There are a lot of resources. I could pull up some of them and share them after. There's really great ones that I came across that different organizations put together. Alberta Health Services, Society. There's the Ontario Student Association, not Student Association. Let me pull some of them out for you guys, and we can share it by email, because I did come across some really good ones for teenagers, for kids, for parents. So I could put some of that together. Oh, and also the Wellness Together Canada, and let me back up. I'm going the wrong way, sorry. This website here, there are resources for teenagers and kids as well. And kids and teenagers have access, minors have access to the Kids Help Phone, also through the same initiative. So there are really nice resources here. I would invite you, if you're interested, if you have time, if you want to look at that, there's a lot that teenagers can benefit from about anxiety, managing stress. There are really nice recordings for relaxation on there too, and mindfulness. A lot on mindfulness, actually. Oh, I need to scroll. Oh no, sorry, there are more questions here. It seems like Wellness Together. Oh, yes. It's exactly what I said. Yeah, they really, it's so great, and it's all free for now during this initiative. And it's very well done. Like, it's accessible, it's easy to understand, and I think that especially for, and no judgment, but for younger generations, they're just really used to doing everything online, and so I think it's really accessible too for them. And so you can create a profile, and then you can track your progress. Also, you can see how you're doing, you can see what resources you accessed. You can do self-assessments, and you can monitor how your progress is going, and you can also, you know, pause things and go back to them, which is really nice also. Are there any other questions that you might have? Or, oh, I have another one here. What about material for young adults rather than teenagers and children? Most post-secondary students. Yeah, well, young adults, absolutely. So any of the material on, well, we were talking about it, Wellness Together Canada is also made for adults and young adults as well. So there are really useful materials on there too. That would be very, very appropriate. And there are also different materials that you'll come across throughout the different health authorities. Often will have a lot available online as well that can be accessible too. So there's some of that, and some, well, yeah, I was going to say, for the ones for minors, if they're dependents, they could access EAP through their parents also. Okay. All right. Any other questions or anything else that you wanted to discuss based on what we saw tonight? Let me just make sure I scrolled all the way here. All right. All right. Okay, I don't see any other questions. All right, I hope I didn't miss any. Thank you very much for hosting this. I feel it helped. Kudos. Well, thank you. That's nice of you. Yeah, my pleasure. I really hope that something was useful for you, that you take away at least one thing. And oh, somebody else heard something. Oh, you guys are so nice. Okay, thank you for your time and expertise. Love the practice of staying in the present even when doing the dishes. Yeah, that's a good one for sure. Thank you for this session. It was clear and helpful with just the right amount of information. Oh, great. Good to know. Good to know. I really hope you did grab at least one thing or thought about something a bit differently. And if you do want to connect with these resources, they're really great. And we'll make the slides available and the recording as well. So thanks so much for joining. Really appreciate your time, and best of luck in the classroom, whether you'll remain in person or virtual. And yeah, if you have any other things that pop up, certainly do let us know. All right, have a good evening, everyone.